If you are on Medicare and you have ever looked up the price of Wegovy or Zepbound and quietly closed the browser tab, you need to hear what changed just 2 weeks ago. There is a new program that lets certain Medicare members get some of these medications for $50 a month. Not 50% off, $50, period. But before you call your doctor's office about this, there are a few details that matter, including one mix-up that shows up in almost every headline about this program, and it is not a small one. For years, Medicare was legally blocked from paying for any medication used purely for weight loss. If you had diabetes or heart disease or severe sleep apnea, your plan might cover a GLP-1 medication for that condition. But if weight was the only reason you needed help, you paid the full price yourself, often over $1,000 a month. That changed on July 1st, when a new federal pilot program called the Medicare GLP-1 Bridge began. This video is for educational purposes only and is not a substitute for professional medical advice. Please speak with your doctor about your personal health and whether this program applies to you. Let's start with what these medications actually do, in plain terms. GLP-1 stands for a hormone your body already makes after you eat. It slows digestion, helps you feel full sooner, and can help the body manage blood sugar more steadily. Medications that mimic this hormone were originally built for type 2 diabetes. Doctors noticed something else happened along the way. Many patients lost a significant amount of weight, sometimes without trying to. That side effect became its own treatment, and it is now sold under names most people have heard of, like Wegovy and Zepbound. Picture a woman named Carol, 68 years old, living on Social Security and a modest pension. Carol has struggled with her weight for over a decade. Her knees ache more than they used to, and her doctor has mentioned, gently, that losing some weight could take pressure off her joints and lower her blood pressure. Carol looked into Wegovy 2 years ago. The price was close to $1,400 a month. She closed the tab, the same way you might have. This month, Carol is one of the people this new program was built for. Here is what the Medicare GLP-1 Bridge actually covers, in 5 key points. Point 1. The program covers 3 specific products, all prescribed for weight loss alone. Wegovy, made by Novo Nordisk, available as a weekly injection or a daily pill. Zepbound, made by Eli Lilly, available as a weekly injection. And Foundayo, a newer daily pill also made by Eli Lilly. If you qualify, and your prescriber submits the right paperwork, your cost for a month's supply is $50. Point 2. This is the detail almost every news story glosses over. Ozempic is not part of this program. Neither is Mounjaro. Both of those medications contain very similar active ingredients to Wegovy and Zepbound, but they are approved and labeled specifically for type 2 diabetes, not weight loss. If your doctor has you on Ozempic or Mounjaro for diabetes, your coverage rules have not changed, and this $50 program does not apply to you. If someone tells you Medicare is now covering Ozempic for weight loss, that is simply not accurate, and it is worth correcting when you hear it. Point 4. Even though the copay is $50, that amount does not count toward your yearly Part D deductible or your annual out-of-pocket spending cap. That is a meaningful trade-off, worth understanding, not a reason to avoid the program, just something to factor into your own math. Point 5. You cannot simply walk into a pharmacy and ask for this price. Your prescriber has to submit what is called a prior authorization, confirming that you meet the medical criteria for the program, generally related to your body mass index and overall health history. If you are already taking one of these drugs for weight loss, your doctor can attest that you met the criteria when you started, even if your weight has since changed for the better. Now let's go a little deeper, because understanding the why behind this program can help you have a much better conversation with your own doctor. For years, Medicare was barred from covering weight loss drugs by law, a rule that dates back decades, when obesity was often treated as a lifestyle issue rather than a medical one. As research on these medications grew, along with public pressure and negotiated price reductions from the drug manufacturers, federal health officials created this demonstration program using a special legal authority that allows short-term pilot projects. It is one part of a broader deal announced last November between the government and the two major manufacturers to bring prices down. Who is likely affected? Health policy researchers estimate that several million Medicare beneficiaries could meet the basic eligibility criteria for this program, though far fewer are expected to actually enroll in the first year. Since enrollment still requires a doctor's involvement and a prior authorization. If you are one of the many older adults managing extra weight without a qualifying condition like diabetes or heart disease, this is likely the first time Medicare has ever offered you direct help with these medications. What people misunderstand. Beyond the Ozempic mix-up, there is a second common misunderstanding worth naming gently. These medications are not a one-time fix. Research so far shows that most people who stop taking a GLP-1 medication regain a meaningful portion of the weight they lost. That does not mean the medication failed. It means your body's hunger signals tend to return once the medication stops, the same way blood pressure often rises again if you stop a blood pressure medication. This is an ongoing area of research, and what long-term use looks like for people over 65 specifically is still being studied carefully. What the research can and cannot tell us. We know these medications produce meaningful weight loss for most people who use them consistently, and some studies suggest cardiovascular benefits as well, particularly with Wegovy. What we do not yet have is long-term data on how older adults maintain muscle and strength while losing weight this way over many years, which is exactly why any conversation about starting one of these medications should include your doctor discussing protein intake and staying physically active, not just the number on the scale. So, what should you actually do with this information? First, call your Medicare Part D plan or check your plan's website to confirm whether they participate in the Bridge program, since not every plan handles it exactly the same way. Second, if you are managing extra weight and do not already have a qualifying condition covered elsewhere, bring this program up directly with your doctor at your next visit. Ask specifically whether you meet the criteria, and ask which of the 3 covered medications might make the most sense for your health history. Third, if you are already taking Wegovy or Zepbound out of pocket, ask your prescriber whether they can submit the prior authorization for the Bridge program on your behalf, since you may already qualify based on when you started treatment. Fourth, ask your doctor about protein intake and strength-supporting activity alongside any weight loss medication. Maintaining muscle matters just as much as losing fat, especially after 65. Let's clear up a few common mistakes people are making right now. The biggest one, as we covered, is assuming Ozempic or Mounjaro are included. They are not. Another mistake is assuming this $50 price is permanent. It is guaranteed only through the end of 2027. A third mistake is assuming any pharmacy can simply give you the discount without your doctor's paperwork. The prior authorization step is not optional. When should this prompt an actual conversation with a medical professional rather than just information gathering? If you have been told you have obesity or a high body mass index and you have not yet discussed weight loss options with your doctor, this is a reasonable moment to raise it. If you are already on a GLP-1 medication and paying full price, this is worth a phone call to your prescriber's office this week. And if you have kidney disease, a history of certain thyroid conditions, or digestive issues, Make sure that conversation includes whether a GLP-1 medication is appropriate for you specifically, since these medications are not right for everyone. Before we wrap up, 3 things worth remembering. This new Medicare program covers Wegovy, Zepbound, and Foundayo for $50 a month when prescribed for weight loss, but it does not cover Ozempic or Mounjaro. It is a temporary pilot program running through the end of 2027, not a permanent benefit. And qualifying requires your doctor's involvement, not just a trip to the pharmacy counter. If explanations like this are helpful to you, consider subscribing. We focus on clear, honest health information for older adults and the families who care about them, without the confusion that usually comes with medical news. If you know someone on Medicare who has looked at these medications and walked away because of the price, consider sharing this video with them. It might be exactly the update they have not heard yet. This video is for educational purposes only and is not a substitute for professional medical advice. Please speak with your doctor or your Medicare plan directly about your own eligibility and health needs. Dr. James Carter is a fictional AI-created health educator, not a real doctor.